Good afternoon. I can get used to these lights up here. Thank you, Peter, and thank you for all the remarks, Karen, that were made that I hope will begin to energize you for this conference. I'm the, as they say, the lead-off band for the big speaker who will be on later, Dr. Mark McClellan. But I want to welcome all of you to this 2013 State Leadership Conference. It is our 30th anniversary. And as we celebrate our 30th anniversary, we're going to get rid of the suspense that Dr. Abrahamson was going to leave you with. Peter already sort of gave a little bit of it away when he said he'd been here 30 years. So I want a real shout out for Dr. Peter Sherris and Dr. Elena Eisman, if both of you would stand. They both have been to every state leadership conference. They must have some stamina. I think one of them wears you out. I don't know how you do it 30 times, but anyway, I'm glad to see a number of you returning to state leadership this year. Many familiar faces and friends and colleagues and psychology champions. Want to extend a special welcome to those of you who are here for the first time, and I had almost forgotten we are video streaming. So for those of you at home in your office, in your pajamas, or whatever your venue is, welcome to the State Leadership Conference. At this time last year, the future of the Affordable Care Act looked pretty uncertain. We had since then a Supreme Court decision that upheld the Affordable Care Act last summer, and then the re-election of President Barack Obama, both of which sort of sealed the fate for the Affordable Care Act. It has survived, and we are getting ready to see the largest implementation of the health care safety net that has ever happened in this country. So the clock is ticking. That's our countdown to health care reform toward full implementation as of January 1st, 2014. And it's coming pretty quickly, maybe a little more quickly than some of you are comfortable with, but it is on the way. But the good news is that January 1st is really only the beginning. It's a mile marker, because this health care reform thing is a marathon. We're facing uncharted territory. Karen, I'm glad you think we have a playbook for everybody to take home with them. I hope that we do. We have a bigger one when you leave here than we had last year. But there's no universal roadmap to getting us there. The details of the implementation of the Affordable Care Act are going to vary from one state to another, probably depending on how red or how blue your state is. And so will the key players. Some states have embraced the Medicaid expansion. Others have chosen not to. Some states have set up health insurance exchanges. Others have chosen to let the feds do it for them. So while the Affordable Care Act is the major driver of health care reform, there are other challenges of which you are well aware to our changing landscape in healthcare practice for psychology. All of you are aware, and painfully so, as we are certainly and have been on staff, of the difficult healthcare environment in which we find ourselves these days, ever increasing demands for cost containment, declining levels of reimbursement, limits on your service delivery, unrealistic pre-authorizations required, greater regulatory requirements, which are certainly a factor in escalating the cost of doing business, whether you're in a clinic or in a private practice, and increased competition in the psychotherapy marketplace, particularly due to growing numbers of master's level providers. So we've got a bunch of stuff on our plate. And add to that some of the acronyms that you heard a little bit earlier, but this fee-for-service, global payments, P for P, and all of that sort of thing, different kinds of payment mechanisms coming into play, some of which are kind of scary when we think about how on earth do we fit a practice model into this sort of changing economic landscape. Marketplace and regulatory developments are encouraging more and more collaborative and integrated practices. So I see our challenges in psychology on three levels. The first level is at the federal level. Healthcare reform provides the backdrop for the three messages that you're going to be taking to the Hill on Tuesday, the three main elements of our legislative advocacy agenda for this conference. The first one is Medicare reimbursement. The second one is inclusion of psychologists in the physician definition under Medicare. And the third one is gaining the economic incentives for psychologists to adopt electronic health records. This is the crux of the messages you're going to go to the Hill with on Tuesday, and each of you will nuance those messages depending upon your particular practice site, patient mix, and that sort of thing. And you'll be hearing a lot more about these in the briefings that you'll be having over the next day or two in preparing you for the Hill. We certainly have our legislative advocacy work cut out for us, given today's political and economic realities. For starters, there are a bunch of new faces on Capitol Hill. We've got some 94 new House and Senate members in the 113th Congress. So we have a lot of relationship building to do, both on your visits Tuesday on the Hill as well as when you get back home. Fortunately, we've had some good friends of psychology who were reelected last November. Senator Sheldon Whitehouse is one. We will be honoring the senator at our state leadership banquet on Monday night. Senators Debbie Stabenow and Orrin Hatch, and Representatives Jan Schakowsky, Frank Pallone, and Lois Capps. They've all been champions for us, and those are relationships we need to continue to support and nurture. But at the same time, we've lost some real champions too. Pete Stark, Senators Olympia Snowe, and Senator Daniel Inouye. In the current economic environment, congressional proposals are filtered through the lens of the budgetary impact, and we've all heard plenty about the budget these days. The pressure to slash federal entitlement funding, including Medicare, remains intense. Beyond the federal level, there are challenges also at the state level. A principal example is that of the Medicaid expansion, one of the biggest healthcare expansions that we will have seen in this country in some time. Millions of consumers are expected to become Medicare beneficiaries, and the Medicaid system is one that is sort of tenuous financially at the state level as are state budgets. But we must pave the way for psychologists and psychological services to be able to be provided to these swelling ranks of Medicaid beneficiaries. And to do that, we need to confront barriers to Medicaid participation and reimbursement structures, and that can only be done at the state level. Medicaid programs in 16 states do not recognize psychologists in the private sector as providers. And for those that do, many place conditions on your providership. They either limit the age of the beneficiaries you can see, or the types of services that you can provide, or the types of settings in which they can be provided. Another restriction requires the, we think, unnecessary physician referral requirement for psychological services. And as of 2010, only about 25 state Medicaid programs even recognized the health and behavior codes, and those are going to become increasingly important as we move into integrated care with Medicaid populations in ACOs, coordinated care organizations, and those sorts of things. APA created these codes more than 10 years ago to facilitate our involvement in integrated and healthcare models so that psychological interventions could be provided to individuals with physical disorders such as diabetes, obesity, chronic cardiac disease, and that sort of thing. In addition to the challenges at the federal and state level, though, there are also challenges to individual practitioners regardless of the setting in which you work. We at APA certainly understand, the governance members and our staff certainly understand that many of our colleagues are anxious and perplexed, and some just downright angry about the many changes that have come and will continue to come their way. Adapting to new psychotherapy codes, figuring out how to participate in this thing called the Physician Quality Reporting Initiative as it moves from a voluntary to a mandatory program, and all the while struggling to keep your individual practices, your clinics, your agencies, and programs afloat while you watch the erosion of reimbursement rates, both by the private insurers and by public sector payers. So it's a difficult environment. One of the many and major ongoing challenges facing practitioners, though, is going to be the need and the necessity of being able to adapt to a changing healthcare system. Looking to the future, viable practice options will vary from one psychologist to another. Some of you may continue to practice just like you do now, especially if you have a well-seated practice, you're well-established, or if you're in a niche practice area. In some cases, a practice can continue to thrive that way because it's not really dependent on third-party or insurance payment. Other practitioners might succeed in the emerging practice marketplace by growing their practices, considering group practice models, or by becoming employed by a large hospital system, an ACO, a coordinated care organization, federally qualified health center, or other kind of practice setting. Some early career psychologists in particular have already embraced this idea of multiple kinds of income streams and practice models which have helped to make their practices more successful. Entrepreneurial independent practitioners like Dr. Barry Anton from Washington State has taken steps to position his practice to take advantage of emerging opportunities. And others, such as Dr. Charlie Cooper, who was sitting down here, I think, sort of in the front, are helping psychologists in North Carolina to assess their readiness for reform and their capabilities for revamping the way that they do business. You will be able to hear from our legal department and both Drs. Anton and Cooper and myself tomorrow in a workshop on new and emerging practice models. Also, on Monday, you'll have the opportunity to attend a workshop about practice integration and working in hospital and integrated care settings. So we're trying to provide a range of informative sessions for you about different kinds of practice models moving forward. So now that we've mapped out the challenges, I want to focus a little bit on what we're doing and what's happening to try to address those challenges and to better bring psychology to the table. One of the first steps in positioning for reform is for us to recognize what it is that we bring to the table. And I think Dr. Anderson addressed this recently in one of his talks about some of our grand challenges, one of which is our own image of ourselves as healthcare practitioners. So we need to understand that we bring a lot of things to the healthcare marketplace. We, uniquely amongst other healthcare providers, have the ability to conduct thorough psychological and in some cases neuropsychological evaluations. We understand environmental factors and family factors and community systems factors that contribute to and help maintain disease. We know how to design, monitor, and evaluate interventions on the individual level, group level, and community level. We know how to promote patient resilience and responsibility and recovery. We know how to apply behavioral factors to modify risk behaviors and the other kinds of interpersonal barriers that keep individuals from chronic illness from getting better. And we understand group dynamics and how to facilitate teamwork, which will be very important in the new interdisciplinary model of providing team care. These are just some of the factors that create the value add for what it is that we as psychologists bring to the table in healthcare reform into the new integrated systems and systems of care. And that's what many practitioners increasingly will need to promote back home, the value and quality that you can contribute to emerging models of care. We are a very highly educated and talented discipline, I believe, and we need to identify and create opportunities to make others aware of the skills and strengths that we contribute to the healthcare system in this country. I know that many in the practice community are upset about reimbursement trends and concerned about the new kinds of models of practice that are going to be required to be sustainable in the future. I practiced psychology for about 30 years, so I'm sort of in the camp with Dr. Eisman and Dr. Scher's cohort. Both, though, within the private and public systems, with a practice that was extremely varied and not dependent on any single source of income. But part of my work involved contract work and involved forensic work, civil forensic work. And even though that work was outside of the third-party payment system, the core foundation for what I was able to bring to that other system was the training that I received as a psychologist and a healthcare professional. When I testified in a civil forensic case, and there was a psychiatrist who was the witness on the other side, it was very important for the court to see me as an equally qualified health professional. I mention that because I believe that regardless of how frustrated we get with the system, and the feelings that many of us have in that regard about what has happened to our practices or what may happen to our practices, we really need to unite and advance and support psychology as a health profession, and in keeping with APA's strategic goal of advancing psychology and health. Because I believe that if we're not valued as a health profession, it will detract from our value in other practice arenas, and we may not have a profession 2 or 3 or 4 decades down the road. So regardless of how we feel about that, we must take our seat at the table. We must contribute to the solutions needed to fix our ailing system. To somewhat paraphrase Dr. De Leon, who I believe is in the audience, psychology will be valued to the extent that we bring our knowledge to bear on the grand challenges in society. I can't think of a grander challenge in society right now than our evolving healthcare system. It is a grand challenge, and it is one that will bankrupt this country in a New York minute if we don't find some solutions for it. And to that end, we need to embrace the entire breadth of our professional strengths and skill sets. And we need to be open to emerging opportunities to apply our expertise in new ways to improve the psychological and physical health of all of our citizens. The Affordable Care Act is paving the way for large integrated practice models, such as accountable care organizations, or ACOs. So we're now working with the New York Psychological Association and the Connecticut Psychological Association to challenge laws that bar psychologists from forming multidisciplinary practices with other health professions. And we're also helping psychologists who are interested in positioning their practices to be able to participate in or negotiate contracts with ACOs and other models that are going to be spurred by the healthcare reform. We're also joining forces with the South Carolina Psychological Association to gain legislation that would allow psychologists to actually be part of the medical staff, not that allied staff that's over there somewhere that the docs don't pay a whole lot of attention to. Importantly, we are collaborating with several state associations to change restrictive state laws and practices regarding Medicaid. Our goal is to open up the Medicaid program to psychologists and to psychological services. I personally believe that Medicaid restrictions on access to psychological services by psychologists in the private sector perpetuates a crummy two-tiered mental health system that we've had in this country for a long time and increases health disparities by not allowing our Medicare citizens to have access to quality psychological services. We have a strong public service ethic. We have an obligation to be part of the solution and to do something about antiquated Medicaid policies and practices that deny individuals who need our services those services. Don't miss our featured presentation on Medicaid reform tomorrow afternoon. We have a terrific panel of speakers, one of whom, Dr. Stephen Gillespie, led a grassroots effort in Oklahoma to get health and behavior codes covered under their state's Medicaid program. It's a great example of how psychology can achieve its goals through sustained grassroots efforts. Now I want to highlight an important new development within APA, the Center for Psychology and Health. Under the direction of our CEO, Dr. Norman Anderson, this new center will oversee and facilitate efforts across the association in service of APA's strategic goal of expanding psychology's role in advancing health. The Center for Psychology and Health blends all of our staff across all of our directorates and the executive office to work together in close collaboration with the APA practice organization to achieve these goals. You'll be able to hear a lot more about the Center for Psychology and Health in the Monday afternoon plenary with Dr. Anderson and with our CEO President, Dr. Don Bursoff. The center also includes a new Office of Healthcare Financing, which will address challenges such as the ongoing concerns we've had in implementation of the new psychotherapy codes, the seeking of new CPT codes that will adequately capture the kinds of work that psychologists do in a variety of healthcare settings. And I'm very proud to announce that Dr. Randy Phelps will be heading that office for us. So now, where's Randy? Now let's shift from the national to the state level. I want to applaud our states for their active engagement in healthcare reform efforts. Numerous state associations have convened summits over the last year and a half to 2 years. And these events have served as a marvelous education, strategic planning, brainstorming forum for psychologists in the states, educating them about the roles that they can play as healthcare reform evolves. I've had the pleasure of participating personally in 10 of these summits. And I asked the psychology leaders in those states, what did you learn from that time your membership spent together about healthcare reform? For some, the forums underscored the real importance of networking, interacting with state directors of Medicaid and with insurance commissioners. Several state leaders told me that the relationships that they have been building over time in their states have really helped to forge their connections and efforts now in service of the healthcare reform agenda and psychology's role in it. Another important point that came to light as a result of these summits is, not surprisingly I should say, there are a lot more questions than answers than we have, and from the reading I've done and from what anybody has, about where we are all really headed with healthcare reform. For our part, APA Practice has been working to support states in several ways in this regard. For starters, there's our state implementation of healthcare reform initiative, which we established in practice in 2011. We began this program to assist states with their efforts at healthcare reform implementation. We launched a community site or a communities group that you can access through the APA website, through your My APA, to get hooked up with that site that has a lot of information that's there for the purposes of sharing publications, reports, discussion forums, and that sort of thing. You can also learn a lot more about this web-based resource and how to put it to good use during a workshop tomorrow morning. In addition to rolling out the APA community site, we've consulted with psychology leaders in states like California and Indiana, whose associations have provided input into the development of the health insurance exchanges and their essential health benefits packages. They're not the only states, though, that have been engaged in this activity. Washington State Psychological Association, for example, submitted formal comments regarding the essential health benefits in their health insurance exchange, with a particular focus to make sure that neuropsychological testing was something that would be included in those essential health benefits. We're also supporting state-level efforts through our CAPS grants program. 2012 legislative grants were given to Louisiana, Minnesota, Mississippi, Missouri, and Vermont, all in their efforts to help support them in opening up the Medicaid programs in their state to incorporate psychological services into primary care settings. I can sum up in 2 words what we encourage state leaders to focus on as the countdown continues to roll: advocacy and education. On the advocacy front, as you've heard some others say, we really have to step up to the plate. And we must absolutely insist that psychological services and behavioral health services and psychologists are included in these emerging models of care and are included in whatever developing payment mechanisms may be out there. We're getting better with our grassroots, but we still need to be stronger, and we have a long ways to go in that regard. Tools like our Legislative Action Center that the practice organization has provided to states helps to connect you not only to your congressional delegations, but also has an application that you can use in your states to connect you directly to your state legislators, which will be very helpful for your reform efforts at home. But the online tools are only as good as their use, so we need you to be using them. I think, as maybe Dr. Dan said, no one else is going to fight these battles for us, and I think those of you who have been in the trenches understand that, and we don't need to expect anybody else to fight our battles for us. We need to look broadly at our advocacy agenda and take advantage of any opportunity we can to help others understand and appreciate the value of psychological and behavioral health services. It's not enough, though, to just have a good message. We got to have good messengers, and that's part of the training that you'll get here in the next 4 days. When it comes to influencing elected officials, our most persuasive voices come from you, psychologist constituents. In your meetings with members of Congress and their staff on Tuesday, keep in mind that they want to hear about your personal experiences as a psychologist delivering services to patients in their congressional districts and the difference it makes when those patients have access to high-quality mental health and behavioral health services. But you know, as I said, I think last year, psychologists in the United States make up only about 1/6, 15% or so, of the entire behavioral health workforce. So we have small numbers, and we need big voices. And one way to do that is to partner with other associations and organizations that share our interest and value what we bring to the table. I can give you a couple of examples. By building a strong alliance with the New York State Academy of Family Physicians, the New York State Psychological Association has increased opportunities and created opportunities to educate family physicians about ways that psychologists can help them with their patients. In New Mexico, the State Psychological Association is focusing its Medicaid reform on activities in primary care, and particularly in rural areas, and has found a partner in the Primary Care Association in New Mexico to help them with that. Now to my second point about what you need to do when you return home, and that has to do with education. This involves both public education and outreach, along with psychologist education and training needed to prepare us for the new practice models that will evolve. Healthcare reform is a very complicated business, and practitioners need education and continuing education and training about a lot of things. One of those things is our skill set, because the skill sets that many of us had that we learned and that were great for a psychotherapy practice don't necessarily translate very well into a primary care practice. So there's some retooling that needs to be done there. Massachusetts and Maryland are well ahead of most other states in implementing the federal health care reform law, and their state associations are actively involved, and maybe they'll share some with you all, some educational materials to help their practitioners envision future professional roles and prepare for the changes that are coming in the healthcare system. Over the years, we've seen many examples of how activities related to our public education campaign have fostered relationship building with policymakers and in turn opened up doors for our profession's engagement in healthcare reform. As part of our psychotherapy awareness initiative this last year, we provided our states with a toolkit that contains resources for building partnerships with primary care and health-related organizations. A couple of the glossy fact sheets from that toolkit are on the table in front of you. Psychologists and primary care, how can we work together? And we hope you will make good use of these materials and the other materials from the website when you return home. Speaking of an education, today is the start of 4 days of intense education, information sharing, networking, and advocacy. And we hope that you will find this conference very informative, energizing, and empowering. Yes, the clock's ticking right towards January 1, 2014. But remember, thank goodness for me, it's not a sprint. It is a marathon. We're in it for the long haul. New models of healthcare and healthcare financing won't take shape overnight. And a bit of history might be instructive here about why it's important for us to be involved. Dan mentioned this briefly in his remarks. When the Medicare law was passed in 1965, for whatever reason, psychology was not included. Psychologists were not included as providers in that healthcare system. It took us 25 years to get included in Medicare. 25 years. We can't afford to be left out of this evolving healthcare system and then have to spend decades catching up. We don't have decades to spend catching up, or we have a whole cadre of early career and students coming behind us that won't have a health profession to practice. So for 2 years now in a row at State Leadership, our theme has been healthcare reform, and we've focused on the critical need to get psychology engaged. And here's the reason. We can't hope to finish the marathon called healthcare reform if we're not at the starting line. Fortunately, many of our psychology leaders have embraced our call to action, and I personally and my staff and the governance at APA appreciate the motivation, the commitment, and the passion that each one of you brings to achieving our shared goals on behalf of our profession and most importantly on behalf of the patients that need our skills and services. Thank you very much and have a great meeting. Now I get a moment of personal privilege, and I want to recognize a group of special psychologists among us, and I would like for them to stand up as I call their name, and please hold your applause to the end. These psychologists have been particularly generous in their financial support of the APA Practice Organization through their contributions to the Practice Leadership Circle, our annual major donor fundraising campaign. So I want to recognize the 2012 donors who are with us. First, there are 10 donors in the Practice Leader category, and these donors made a single gift between $500 and $999, and they include Dr. Barry Anton from Washington State, Dr. Anita Auerbach from Virginia, Dr. Don Bursoff from Pennsylvania, Dr. Cy Gross from Minnesota, Dr. David Hill from Kansas, Dr. Joe Johnson from Michigan, Dr. Jennifer Kelly from Georgia, Dr. Susan McDaniel from New York, Dr. Sheila Schuster from Kentucky, and Dr. Virginia Waters from New Jersey. 4 major donors with us today gave in the Practice Guardian category with a single gift of over $1,000 or between $1,000 and $2,500. And they are Dr. Roz Dorland from New Jersey, Dr. Nancy Gordon-Moore from Washington, D.C., Dr. Bonnie Markham, also from New Jersey, and Dr. Karen Postal from Massachusetts. So please give them a warm, hearty round of applause. Now, I said when I came out I was the warm-up band for the real deal, and so now I have the genuine pleasure of introducing to you all the real deal, our keynote speaker, Dr. Mark McClellan. Dr. McClellan is Senior Fellow, Director of the Engelberg Center for Healthcare Reform, and Leonard D. Schaefer Chair in the Health Policy Studies at the Brookings Institution. The Engelberg Center at Brookings provides practical solutions to achieving high-quality, innovative, affordable health care, with particular emphasis on identifying opportunities at the national, state, and local levels. Both a physician and economist by training, Dr. McClellan has a highly distinguished record in public service and academic research. He is the former administrator of the Centers for Medicare and Medicaid Services. That's a group we all care a whole lot about. And former commissioner of the Food and Drug Administration. He also served as a member of the President's Council on Economic Advisors and Senior Director for Healthcare Policy at the White House. In these positions, Dr. McClellan developed and implemented major reforms in health policy. Dr. McClellan also served as an Associate Professor of Economics and an Associate Professor of Medicine at Stanford University, where he directed Stanford's program on health outcomes research. He was an Associate Editor of the Journal of Health Economics and co-principal investigator of the Health and Retirement Study, a longitudinal study of the health and economic status of older Americans. He has twice received the Kenneth Arrow Award for Outstanding Research in Health Economics. Dr. McClellan holds an MD from Harvard University, Massachusetts Institute of Technology Division of Health Sciences and Technology, a PhD in economics from MIT, an MPA from Harvard University, and I want to hear a shout out now, and a BA from the University of Texas at Austin. Where are our Texas people? He completed his residency training in internal medicine at Brigham and Women's Hospital in Boston, is board certified in internal medicine, and has been a practicing internist during his career. So you can see why we are absolutely delighted to have Dr. McClellan here with us today to share his insights and perspectives. Please join me in welcoming Dr. Mark McClellan.